Hello, I'm Pavneet Singh. I'm going to talk about my research proposal which is on the side effects of X-rays on the oral cavity. There's an urgent need to understand the biological effects of radiation and oral cavity so that a person can make an informed choice about getting a radiograph taken or not. The purpose of this study is to systematically review the effects of radiation on the dose and immunological effect on the oral cavity and the radiation exposure on the operator by a portable X-ray machine. This research proposal will also examine the effects of X-rays on the salivary gland and immunity. The goal of the review is to gather 5 research papers that meet all inclusive criteria in this research. We will be collecting we will be collecting data from 50 patients of dental and oral hospitals, those who need panoramic X-rays. The aim of this systematic review is to shed light on the changes that occur when X-ray beam hit the oral cavity and on the salivary gland. Immunity and the amount of effect to the X-ray beam to the operators, those who use portable X-ray unit. X-rays are a form of electromagnetic radiation which is kind of visible light. So what is a visible light? Visible light is a segment of the electromagnetic spectrum the human eyes can see. Dental X-rays are the images of the teeth or tooth which is taken on the phosphor plate or direct sensor. They are also used to diagnose disease and any injury to the teeth and gum. These X-rays affect the salivary gland, which are gland that discharge fluid, secretion, and especially saliva into the mouth cavity. That in humans comprise large compound of racemose glands. It includes three kinds of glands, which are sublingual gland, submandibular gland, and the parotid gland. So I come across a question that is there side effects of radiation on the oral cavity, which we will be discovering in the further proposal. So I have discovered so far that even smaller dose can affect the oral cavity, so the recommended dose should be used. X-rays affect the salivary gland, which are glands that discharge a fluid secretion, especially saliva, into the mouth cavity. It affects the immunity of the oral cavity. So what the objective of the study is of this proposed systematic review is to determine if there is evidence in research that really states that X-rays radiation have side effects on the oral cavity. In order to determine this, a systematic review of data will be completed on longitudinal prospective studies involving X-ray radiation, which causes effects on the oral cavity, those who are being exposed to X-ray radiation, which is necessary and higher than the recommended dose. So the study design. The systematic review will focus on longitudinal prospective studies in which the patient will be exposed to radiation of higher than the recommended level, as well as getting exposed to more than once utilized a control setting. These studies are observational in nature and are considered coherent case control studies. The outcome of interest will be seeing what happens to image quality, effect on macrophages and lymphocytes cells, as well as effect on the other body parts. The comparator control will be the second X-ray, which will be taken according to the recommended dose level on each patient. The systematic review will be qualitative in nature. There will be strict inclusive or exclusive criteria to choose the population for this review. 50 research patients from the deep university, those who need prescription or X-rays being taken, will be used to meet all inclusive criteria, which will be included in the systematic review. Only those articles will be summarized and finding present in narrative form. The inclusive criteria will include 50 individual patients, those who need X-rays to be taken, scholars, doctors, X-ray machine, access to control room, longitudinal prospective studies, cohort and case control studies. The exclusive criteria will be patients who do not need X-rays, those who are not prescribed X-rays either. The ethical consideration will be taken into view when we do this research. How will this benefit the people and the doctors? This will benefit the people and doctor as they will have data and evidence to back up that whether they need the X-rays to be taken or not. Dental hygiene can advocate on why the X-rays needs to be taken, because some teeth we need to see the root of the teeth so that they can see the teeth properly and they can diagnose the patient more properly. To conclude, the operator position is as important as the patient position on whom this X-ray is going to be taking place. The x-ray should be taken according to your recommended dose. As if the x-ray dose is more than the recommended dose, then the client can refuse to take the x-rays to be taken. Dental hygienist or doctor should also tell the patient about some effects they can have after getting the x-rays to be taken, like xerostomia or lower immunity in the oral cavity. To conclude, I will say that this research proposal is very important. So it tells the patient and the doctor about the effects or side effects of the x-rays on the oral cavity. Thank you.